HDAC inhibition is important because there's still no curative option in myeloma. So we need to continue to explore alternative strategies. And there's a very powerful rationale for this inhibition in myeloma that's been demonstrated by preclinical work and clinical trials so far, showing that you can resensitize resistant disease with the use of these drugs. So outcomes in patients with very few therapeutic options are going to be increased. Well, the evidence for HDAC inhibitors so far has been in patients with multiply relapsed disease. But I think because of the fact that they're generally oral agents and probably have multiple mechanisms of action, we need to explore them in earlier phase disease and perhaps in entities like smouldering multiple myeloma, where we may have the ability to change the natural history of the progression to symptomatic myeloma by using these agents earlier. I think to use the agents optimally, we need to understand better their mode of action. There are various theories about how they work, and there's various levels of evidence for some of those theories. But I think what happens when we use them clinically is still very unclear. And there's certainly evidence that there could be direct anti-tumour action, but also it's highly likely that they've got an immunomodulatory capacity, which will be very important for long-term disease control and perhaps for combination approaches with other immuno-oncology agents.